it impacts on your health and your well-being, we'll most definitely talk about it. Some of you call it a program, I call it a promise. Some of you call us a frequency, I say we're a family. Salute to you all. My name is usual, Nortey by nature. Ultimate health is in its effect. Start as a rainy day, but we can see clearly now, can't we? I hope you can see clearly.
I can see clearly now. The rain is gone.
Jimmy Cliff's rendition of that lovely, lovely, lovely oldie
Can see all that's
by Johnny Nash. But you do know it's time for Ultimate Health on Joy 99.7 FM, huh? Today we do a bit of cancer awareness and we focus on Hodgkins lymphoma. I know it when you hear cancer, huh? You're not too happy, but we need to know about these things. They do exist, they do affect our health and our well-being. So today we're looking at a rare cancer that affects the lymphatic system. Yeah, it's actually the body's sewage system, huh? I'm sure you've heard lymph nodes before. But I'm in the studio with Dr. Hamza Bashir. He's with the 37 Military Hospital and he works in the area of internal medicine. Next to him, I have the president of the Michael DeGraff Foundation. They are committed to spreading awareness about Hodgkin's lymphoma, providing support for those affected and afflicted. And on Zoom, I have senior specialist hematologist with the University of Ghana Medical Center, Dr. Nana Ajewa Ewuku. So we'll be talking about Hodgkin's lymphoma. If you have any questions and concerns, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube, and shortly we'll activate the phone lines. Gentlemen, you're welcome to the studio. Ezekiel and Hamza, you're most welcome.
Thank you very much.
Thank you.
Right. Many people get a bit scared when we start talking about cancer. And we typically do a lot more about the breast cancers, prostate cancer, and so on and so forth, cervical cancer. We tend not to talk too much about the lymphomas and other types of cancer. So, Dr. Bashir, let me start with you. Briefly, just give us a scope. What is Hodgkin's lymphoma?
Okay, thank you. So first of all, as you've said already, it's an often overlooked aspect, Hodgkin's lymphoma, other lymphomas as well, not as common as breast cancer,
Right.
but it's still a deadly disease. So it's we thank you again for letting us the
You're most
opportunity
welcome.
to speak about this. So lymphoma is a cancer of the lymph node. So I'll
Right.
go into detail about
Right.
what cancer is, what lymph node is. Um, so in lymphoma, there's two types. There's Hodgkin lymphoma, then there's non-Hodgkin lymphoma. Today we're talking about Hodgkin lymphoma.
Right.
But I want to preface this that the symptoms in both of them, they are quite similar.
Similar. Right.
So if you see these symptoms and you go to the hospital, you can be diagnosed with either of them.
Right.
It's through further testing that we can differentiate between the two.
Great.
So Hodgkin lymphoma, a type of cancer that involves uncontrollable growth of cells in the lymph nodes. So first of all, what is a cancer? A cancer, to explain to those who don't understand, because I've talked to some people who thought maybe cancers are caused by viruses or bacteria. They don't really know what cancers are. So
Joy99.7 FM.
cells, they grow. When they need to grow, they grow. When you've maybe damaged a part of your skin or something, the cells there, they grow and they heal. But sometimes it can happen that in that growth, there can be an abnormality. And because of that abnormality, there can be a mutation in the cell. And now this cell, the body, once it's done growing, the body tells this normal cell that, okay, stop growing, I don't need you to grow again.
Right.
But this cell that has a mutation, it doesn't listen. So it keeps growing and growing and growing and growing. So this is one basic aspect that you see in
So
almost all
uncontrolled
cancers.
cell mutation, cell growth. Right. Cancer. Right.
Yes.
Okay.
Then next up, what is a lymph node? So the immune system of the body is the system that protects you from infections. I wanted to go a little bit into that. I can categorize them roughly into white blood cells and the lymphatic system.
Yeah.
So the white blood cells, and I like to use the analogy of police officers here, right? So where the white blood cells, they are the police officers who are there in the streets catching criminals, all that stuff. The lymphatic system is like the police station, the police academy, and these organizations. So a white blood cell or a police officer will catch a criminal or a disease-causing organism, and it will take it to a police station or the lymph
The
node.
lymph node or the lymph glands.
Yes.
Right. Okay.
So a lymph node is a collection of these police officers. They get brought the disease-causing organism and they deal with it. They kill it.
So when your lymphatic system is working properly, adequately, then it's filtering the lymph from the blood, right? Taking that to these police stations, the lymph nodes,
Yes.
right? And we're now discussing a cancer of the lymphatic system, right?
Yes.
Which relates to the lymph nodes.
Yes.
Okay.
Yes.
Right.
So I've talked about the types, the Hodgkin, non-Hodgkin.
Yeah.
Then Hodgkin's, there's some types, but I don't want to get into that
No
because
problem.
For the general public, it doesn't really help them at all. But I want to get into why it's important to know about this
Yeah.
condition. So worldwide, in 2020, there were 83,000 new cases of Hodgkin's lymphoma, and
Okay.
of them, there were 23,000 deaths. So this is a large number. In Ghana, too, in the year 2021, there were 146 new cases,
New cases.
and of them, 64 of them passed away, sadly.
Right. Okay.
It is most common in people of the ages between 15 and 35 and people above 55 years of age.
Right.
And it is actually the most common cancer in people of ages 15 to
Right.
19.
The young
so
persons,
yes,
right.
so the SS students, they are most at risk. Is the most common cancer in them.
Right. Okay. Let me just bring in Dr. Ewuku. Do we have it online? Yeah. Dr. Ewuku, can you hear me?
And
Hi. Right. Thanks for joining us. We're streaming into your territory. Hodgkin's lymphoma. We just had an explanation. Abnormal cell growth, right? And affecting your white blood cells, and then it goes into the lymphocytes, and then it goes to the lymph nodes. Is there anything you want to add?
Okay, so basically it's not just lymph nodes, so it's the lymphatic system.
Lymphatic
So the
system, yeah.
lymph part, the spleen, it can even have a primary bone marrow lymphoma. So it's in addition to the lymph nodes, you can have the spleen, you can have the bone marrow, and yeah. So there, and anywhere you find lymph nodes, so you can have lymph nodes in your stomach. So it's not just the ones we see in the periphery. So that's basically what I wanted to
So not
articulate.
just the neck and the lymph nodes. For listeners and viewers, when you are ill or there's an infection ongoing, you get these swellings in your armpit or the axillary area, your neck, sometimes your groin area. These are all lymphatic organs, right? The police stations that Hamza was talking about, okay? Because the system picks up all the bad stuff in your blood, in your system, and cleans it up and then sends it back. So it's like your waste management, your Zoom line in your body, right? And that's what we're talking about. And we're moving to talk about where the cells in this system grow in an abnormal way and therefore are a form of cancer. If you have any questions, concerns, WhatsApp 055 11 11 997, and we're live on Facebook and YouTube. Let me just quickly, I'll come back to you, Dr. Uku, but Ezekiel, I know of the Michael DeGraft Foundation, right? Founded by the mother of Michael. Michael is a young man, young Ghanaian, who was affected by Hodgkins lymphoma. Sadly, we lost him. His mother has set up this foundation to raise awareness. I know we lost him at the age of 19, I believe.
Yes, 19.
He was a student of the UPSA, right?
please.
Formerly IPS. Tell us a bit quickly just about the foundation, and then we'll come back to the clinical aspects.
Okay, so the Michael DeGraft Memorial Foundation was basically set up because of the loss of Michael.
Mm-hmm.
So Michael was diagnosed with Hodgkin's lymphoma in SHS2 when he was 16 years old,
Mm-hmm.
and he was diagnosed with stage 4 of Hodgkin's lymphoma.
Right.
So we lost Michael when he was 19 on the 21st of January 2020.
Right.
Okay, so this foundation was basically brought up to help people who do not have the means to afford for this cancer, this
Right.
type of cancer.
Mm-hmm.
That is the needy who are in this situation and they need help.
Right.
Okay, so we help people with this kind of cancer, and then we create evangelism. Because right
So it's a
before,
church-based organization. It's a faith-based organization.
not necessarily
necessarily, okay.
faith-based, yeah. So we help people who cannot afford for their bills,
Mm-hmm.
and then we also share the word.
Okay.
Because before he passed, he left a message which
Yeah.
is to encourage people find their path with Christ.
Okay.
So this foundation is basically to help people who cannot afford for Hodgkin's lymphoma cancer.
Okay, this is the Michael DeGraft Foundation. Now, let me ask you, Ezekiel. So, when you say you help people who can't afford, already I'm sure my listeners are thinking you got buckets of money, right? How do you do that? Is it that you have a fund? How do you help people with, because cancer treatment is expensive? We'll get to that with Hamza and Dr. Uku in a second.
Okay.
How do you do
So
that?
basically, we set up this whole foundation about 2 years ago, and then we had a fundraiser that was in last year,
Mhm.
August. So we used that amount of money we got from the fundraising to help about. So far, we've taken care of 3 people.
Right.
We've lost 2, and then 1 is fine.
Okay.
Okay, so we used the money we got from the fundraising to help the patients we got. But then internally, where as of now we do not have sponsors.
Right.
So internally we contribute amongst ourselves
Okay.
to help people with this particular kind of cancer.
Right. So essentially, fundraising
Yes, please.
and generating funds to help those afflicted and affected by Hodgkin's lymphoma is a big part of what you do.
Yes, please.
Okay, right. Let me come back to you, Dr. Ewuku, if you can hear me. So we know that something has gone wrong with the lymphatic system, and Hodgkin's lymphoma is one of these challenges. Are there any known causes or risk factors that we can relate to? And if you could also explain to my listeners, why is it that it typically afflicts or affects the young?
Okay, so yes, there are no known causes, there are risk factors. There's been associations with Epstein-Barr virus. It's something that causes, it's a virus that causes a benign form of disease called infectious mononucleosis. But sometimes the virus can become latent and later on cause mutation in the cells, like Dr. Hamza was talking about
Right.
earlier.
Okay.
Also been found associated in people who have HIV infection, and it is thought that the HIV infection will reduce the body's immunity. So then the body is not able to fight it's able to evade the person's immune system that is low, so it's
Okay.
not able to fight it. Then there can be mutation and can lead to this abnormal proliferation and growth. And also, it's also been noticed that there's an increased risk in first degree relatives. So if there's a relative who gets Hodgkin's lymphoma, there's a fivefold risk of another relative getting it. When we say risk, it doesn't mean that by all means this person will get it, but then it's higher. So then you'd have to be alert and look out for things and report to the hospital early so that it can be detected.
Okay.
People who have been who are involved in woodwork, farming, who deal with industrial solvents like benzene,
Right.
it's been found that they also have an increased risk. Let me also add that there are people who do not have exposure to any of these things, but they still get Hodgkin's lymphoma.
Okay.
So it's not as if, oh, I don't have all these exposures, so I cannot get it.
Okay.
It's just a risk, and
Alright.
you may not have any of these risks, but still have Hodgkin's lymphoma.
Okay. Is it sex indicated or sex related? It's highly or more prevalent in males.
Yes, some types we found that it's higher in males than in females. But then the nodular sclerosing, there are different subtypes.
Different
One of the
types.
subtypes
Yeah.
seems to have a more higher incidence in females, but generally it's commoner in males than in females.
Okay.
We really don't have any scientific basis for that, but it's something that maybe
Okay.
we need to look more into it. But it's commoner in males than in females.
Okay, great stuff. If you just joined us, it's 24 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. We're seeking to get an understanding of what Hodgkin's lymphoma, a form of cancer, is. And you've just been listening to Dr. Nana Ejewa Ewuku, a specialist hematologist with the University of Ghana Medical Center. In the studio, I have Dr. Hamza Bashir. He's with the 37 Military Hospital in the area of internal medicine. And next to him, Ezekiel Laye is the president of the Michael de Gracht Foundation. If you have any questions, concerns, experiences, share them with us on WhatsApp 055 11 11 997. We're live on Facebook and YouTube. Shortly, I will activate the phone lines so you can ask your own questions. Now, let me come back to you, Dr. Bashir. Of course, people are wondering, well, these are risk factors. They don't seem to be things that you can tie down or consider too common. But another thing that we hear, and also with regards to Michael's story, is that it's pretty difficult to pin down. Let's talk a bit about signs and symptoms that we can talk about and associate with Hodgkin's lymphoma. Signs and symptoms of Hodgkin's lymphoma, though they may vary with the different types, but the general signs and symptoms.
Okay, right. So the signs and symptoms, I think, is the most important part of this conversation, because this is what the general public
So
should
people need to look out for that.
Yes.
Yeah. Okay.
So first of all, like I said, the lymph nodes, the cells are growing in the lymph nodes uncontrollably.
Okay.
So inevitably, the small lymph nodes will start to expand and expand and expand, and become bigger.
Right.
So the most common, the first symptom actually is an enlarged lymph node, and in
Right.
60 to 80% of cases, it's in the neck.
Right.
So on the sides of the neck,
Right.
under the chin, in front of and behind the ear,
Right.
and also above the collarbone.
Okay. So you can feel these, and sometimes they actually become visible as well. The swellings.
Yes.
Okay.
Yes.
Right.
Yes. And it remains there, and this is the first symptom that appears, and it remains there for quite a few months. That's why it's not caught very well, because the only the next symptom that you get, it's once the disease has advanced.
Right.
Mhm. So
Okay.
it's very important people remember this.
Mhm.
Enlarged lymph nodes
Okay.
in the neck most commonly.
Most commonly in the neck, and then sometimes the armpit.
Yes, in 10 to 20% of cases in the armpits, in
Okay.
5 to 10% in the groin,
The groin.
and then it can also be in the GI system, but those are not. I mean, of course,
Right.
people are not going to be able to detect those unless
Okay.
they come to the hospital.
So
and we detect
swollen
them.
lymph nodes.
Yes, please.
Right, which suggests that the collection of abnormal cells has reached the lymph glands and then is causing this swelling. Right. Alongside that, is there anything else?
Yes. So this is the one and only symptom in the beginning, but once it advances a little bit, next you start having fevers, and
Right.
these fevers are without reason. Normally, you get a fever when you get an infection. So along with the fever, you have a sore throat, a cough, chest pain, stomach pain, diarrhea, these kind of things.
Okay.
But these fevers, they appear
Can
on
you
their
just
own.
just briefly for my listeners? Sorry, I'm interrupting you, but you know, in our part of the world, when you say fever, to many people, malaria, right? So just explain what you mean by a fever as a symptom, okay? Because very often people hear fever, they're thinking malaria.
A fever is just the body's temperature increasing. So
Right.
the normal body's temperature is 36.5 to 37.5. A fever is above 38.
Right.
Okay.
Okay.
So it's basically the body increasing its temperature to help fight off an infection.
Okay. So the person may have elevated body temperature.
Yes.
Right.
Elevated
Okay.
body temperature.
Good.
But in infections, there's a cause, there's a bacteria
Yeah.
there. But in lymphoma,
Understood.
it appears on its own and appears for months on end, right? Unexplained fever for a long duration, and it
Right.
usually appears for 1 or 2 weeks, and then it goes away for 1 or 2 weeks, then it will appear 1 or 2 weeks. This is a
Okay.
characteristic feature of it.
Right. Okay.
Then next we have night sweats.
Right.
Basically, you sleep at night in a you sleep at night, and then you wake up and all your clothes are drenched, your bed sheets is drenched,
Okay.
and this is unexplained. It's not like it's particularly hot outside or anything like that.
Right.
Because in that case, of course, you're going to sweat.
So an
But-
averagely ventilated room, but you are sweating
You are sweating.
and you are drenched. You are wet.
Yes.
Your bed clothes are wet. Night
Mhm.
sweats. Okay.
Yes,
What
night
else?
sweats. Next, we have weight loss, and this is weight loss also unexplained, undesired weight loss.
Right.
It's not usually because of stress you can have weight loss, but if you've had the same life routine for the past 3 years, but then you've seen the past 6 months you started
A
losing
significant loss of weight,
weight. Yes.
body mass.
Mhm.
Right.
Unexplained.
Unexplained.
Yes.
Okay. Right.
Uh,
Mhm.
Then of course, as it progresses, we can have other symptoms as well. It can go into the chest lymph nodes. There you can have cough, chest pain, shortness of breath, and sometimes coughing up blood.
Okay.
Which, I mean, that's a red
Right.
a red flag right there.
Right.
Then you can have an enlargement of the spleen, which is an organ in the upper left of the abdomen. So it enlarges. Then also of the liver. The liver is the organ that helps to detoxify the blood and a lot
Okay.
of other functions. So it can become enlarged.
Right.
Next, it can also go into the bone marrow, or it can even start from the bone marrow,
Right.
as
Dr. Uku
Dr.
said.
Uku said. But if it goes into the bone marrow, it can destroy the bone marrow. For those who don't know what the bone marrow is, the bones, human bones, they have cells inside them,
Mhm.
which if we use our earlier analogy,
The part we like cracking when we're eating meat and
yes,
Yeah.
So that's the
Yeah,
bone
that's I
marrow.
have to help you there. You know,
Yeah.
when you're eating, when we are having prawns, there's this soft middle part that people like to
exactly. Yeah.
crack out.
Mhm.
That's the bone
That's the
marrow.
bone marrow. Right. Let me just ask. I know at some stage, itching is a significant symptom. Can either of you talk about that?
Yes, so itching is also itching occurs because there's a lot of cells being produced and a lot of cells being destroyed.
Okay.
So because of that, they release their internal proteins into the body, and that can cause itching.
Causes you itching.
Yes.
Right.
So for itching for a prolonged duration.
Okay.
is a significant factor of it.
Okay, so let me swing to you. And listeners, if you've just joined us, we're talking about Hodgkin's lymphoma, a type of cancer. And we're trying to understand it and then look at the treatment and management modalities available here in Ghana. If you have any questions, concerns, WhatsApp is 055 997. We're live on Facebook and YouTube. And shortly I will activate the phone line. So, Dr. Ewuku, let me come back to you. So, well, let's say, yeah, I do have night sweats. I may or may not have the other things, but we've mentioned the swelling of the lymph nodes, right? Typically around the neck and throat area, the armpits, maybe in the groin and so on. Does that mean I have cancer? Does that mean I have Hodgkin's lymphoma?
No, it doesn't.
So my question on the, just to
Yes.
to land is that
other-
how do we conclusively diagnose this? Because I'm sure there are listeners listening to us and like, oops, okay, I had a couple of things that may apply to me. How do we conclusively diagnose Hodgkin's lymphoma?
Okay. So once you experience all the symptoms Dr. Hamza has talked about, you come into the hospital. We need to take out the swollen lymph node and take it to the lab, the pathology lab, and look at and under the microscope, do some staining to be able to tell that you have Hodgkin's lymphoma.
So we're taking a sample from the lymph node for biopsy.
Yes, for biopsy. So we biopsy it,
Right.
and then we take it to the pathology lab, and we do various investigations on it, and then we can then say you have Hodgkin's lymphoma. Because there are other things that may look like Hodgkin's lymphoma. So somebody can get tuberculosis and may have the cough, the weight loss, the night sweats, some enlarged lymph nodes, even though they may not be that big.
Okay.
It doesn't necessarily mean that once you have it, you have Hodgkin's. You need to come into the hospital so that a biopsy is taken and then we can diagnose you as having Hodgkin's. Or it could be a non-Hodgkin's lymphoma. Like, remember Dr. Hamza talked about there are different types of Hodgkin's lymphoma.
Okay.
So it
Right.
needs a biopsy.
Okay, we tend to hear the umbrella term blood or blood-based cancers, the lymphomas, and so on and so forth. But how different is this, if I may ask and get a brief answer for my listeners? Is this from leukemia?
Okay. So leukemia is in the bone marrow. So the bone marrow is the factory site for the production of the various cells of the body. The red blood cells are protectors or are defense mechanisms. The white blood cells, the platelets. The platelets are little tissue cells that prevents us from bleeding out. So they help with clotting. That's where the bone marrow. That's what the bone marrow does.
Okay.
So once you get a type of cancer in the bone marrow and in the blood, so the blood that flows through us. Remember, we talked that the lymphoma is in tissue, so it's in the organs or in the tissue, and then lymphoma can spill over into the blood in the bone marrow.
Okay.
But usually, it's the non-Hodgkin's lymphoma that does that.
Okay.
But so the blood, the liquidy part is the lymphoma, and the solid food is the lymphoma to make it a little easier for. So in organs or tissue is lymphoma, in blood or bone marrow is leukemia.
Leukemia. Okay. Right. I hope that clarifies some of the issues for you. So once we have a biopsy done, we have a conclusive diagnosis. Okay. Just quickly, Dr. Bashir, I'm still at sea as to why this very, very young age spectrum, 15 to 35, typically are struck down by this. Is there any reason for this?
Okay, so we don't specifically know why it happens. It's just that we have analyzed the people who have gotten these diseases, and then we have seen that what they have in common is, yes, they have a pattern of being between 15 and 35, and also above 55 years of age.
Okay, great stuff. I've got a couple of questions here. My question to Dr. Hamza, as a practitioner at 37 Military Hospital, what is the prognosis or the outcome, the outlook of Hodgkin's lymphoma if detected early, and is it as serious as ligma? This is Zion Secondis Secondies from Spintex. Is he a friend of yours? Okay.
I'm
Right. He's looking at outcome, but outlook or prognosis. But I was going to ask a question along those lines. It is known as a very aggressive cancer, but if detected early, it has one of the highest treatment and, in quotes, cure rates. Right. So can you add that to your answer to this question?
okay. So it's one of the good things. Well, no.
Well,
One of the things
comparatively, compared to other cancers.
Yes,
Yeah.
compared to other cancers,
Yeah.
is that it's relatively treatable.
Okay.
So for cancer, cure is a difficult word because cancers can't really be cured. So we say they go into remission, meaning
right.
that the levels have gone down, that they're not causing any trouble. So you need, once they have gone into remission, you need yearly checks to see, are they coming back? Are they
Okay.
coming back? Okay.
Right.
Next, the prognosis.
Mhm.
It has a very good prognosis. Depending on the type, the progression, how early we caught it, what kind of symptoms we have, it can have a prognosis of anywhere from 80% 5-year survival to 40% 5-year survival,
Okay.
and which is actually very good compared to
And when
something
you
like
use
breast cancer.
those parameters, you're saying that if you're diagnosed, the 5-year survival is really speaking to the percentage of those diagnosed that will still be alive
Yes, yes,
Yeah.
after 5 years.
yes,
Okay.
exactly.
Right. Is that a good, I mean, if I have it and you tell me that, well, in 5 years I'll still be around 80% of it, is that a good, is it good news
Well,
compared to others?
compared to others, yes, cancer is a dangerous disease compared to breast cancer, prostate, something like colon cancer, which is can be very aggressive. This is actually a good
Right.
5-year
It's a
survival
good
rates.
benchmark, an indicator, or an index to have, right?
Yes.
Okay. All right, folks, I'm going to activate the phone lines. We're still progressing and understanding this. We'll be talking a bit more about the treatment options and so on and so forth. I went on the page of the Michael DeGraft Foundation. There are very, very, very inspiring, should I say, testimonies from young persons who've gotten some support. Okay, of course, there's information about those we lost sadly because they were detected later or in an advanced stage, right? The name of the foundation is Michael DeGraft, right? DE hyphen and then Graft, Michael DeGraft, okay? Foundation was set up by his mother. Sadly, we lost him at the young age of 19. So these are serious things. These are real things we are talking about. Ezekiel, I caught some of those stories on your site.
Okay.
Congratulations on what you've been able to do so far.
Thank you very much.
But what does that mean? So it means anybody listening to us who has either been diagnosed or feels they have something similar to what we're describing, contacts the foundation?
Yes.
What was the procedure?
Okay, so after you've gone to the hospital and you've been diagnosed of Hodgkins lymphoma,
Okay.
and then you do not have the means to cater for yourself, you can reach out to us on 027 9087 or you could visit our website.
Slowly.
Okay.
All right.
So
Serious business. 027.
9087 486. Or you could reach us out to us on MD on any social media platform.
Right.
MD Memorial Foundation.
Okay.
Or you could visit our website, that is mdgraftfoundation.org.
Okay.
Yes, so when you reach out to us, we take it from there.
Okay.
Yes, please. But we are
Right.
looking at touching.
But people who you are asking or people who you ask to reach out to you must have a confirmed diagnosis.
Yes, please.
They
exactly.
must.
Yes, please.
Okay. And you have an army of volunteers?
Yes, please, we do.
Your own leukocytes or lymphocytes or white blood cells. Who are these people? Who are these volunteers?
Okay, so the volunteers are basically friends of Michael, loved ones,
Okay.
and then people we talk to. So once we go on processions, we've gone for processions for some time now,
Okay.
and we've touched about 20,000 people.
Right.
So when we talk to you and you feel like you want to be a volunteer of the Michael DeGraft Foundation, you contact us on any of the phone lines.
Okay.
And then we proceed from there.
Okay. So this is specific to Hodgkin's lymphoma.
Yes, please.
You're
Hodgkin's
not
lymphoma.
saying everybody should come to you. Just
No.
this specific, of course, it was
Yes.
set up
Because
in the memory
yes, please,
of Michael. All right. Okay. Folks, I hope you've gotten that number. I'll repeat it again in a sec. We're talking about Hodgkin's lymphoma. My phone line 0302216541. Active, we're live on Facebook and YouTube. Yes, there are quite a lot of stories out there, and treatment is highly successful if it's pinpointed, diagnosed early. But let's look at treatment and treatment modalities. Dr. Uku, are you still with us? Oh, hang on. Let me just read this quickly. Good afternoon, Nortey. How are you and your respected doctors over there? Please, I would like to know whether the treatment has been included in the National Health Insurance Scheme or is on its own. If yes or no, how much does it cost? We're going into treatment now. This is Hayford from Bato. Thanks for that message. Do I have any more? Right. Okay. So you can WhatsApp us 055 11 11 997. We're talking about Hodgkin's lymphoma. Right, Dr. Uku. So having been conclusively diagnosed, what are the next steps and what are the treatment modalities available?
Okay. So once you've been diagnosed, we stage it.
Okay.
To know maybe to know the severity.
The severity,
Let's
right.
say that. So we stage it. So we have stage 1 up to stage 4.
Okay.
The treatment modalities include radiotherapy, radiation therapy, and then we have chemotherapy. And there are also some immune therapy which are added to radiotherapy. Radiotherapy, which are added to chemotherapy. Radiotherapy for the early stages. So stage 1, stage 2A. So the staging is a little, but if you have early stage, we do a combination of radiotherapy and chemotherapy. But the chemotherapy, you have a very short cycle compared to somebody who has late stage disease or advanced stage disease, which is from stage 2B to stage 4. Then that one is chemotherapy. And that one, you have a longer duration of your chemotherapy cycles.
Okay.
We may still...
Let me just jump in there, Doc. If you can quickly, I'm looking at my clock, but quickly, when you say radiotherapy, I know I have discerning listeners, right? What essentially are we doing?
Okay, so that is for the radio oncologist, but let me try. So we are giving you radiation to where the lymph node or the field where you have lymph node, try and kill the cancer cells there. Okay. So it's like and it's as medically calculated radiation that we are given to that area, that involved area.
Okay.
That's why it's good for those who have early disease, because if you have advanced all over, we can't to radiate your whole body.
Okay. So radiotherapy is targeted radiation to the actual specific target areas, right?
Yeah.
And what you're sharing with my listeners is that if it has advanced beyond these early stages, then it has spread, right?
Yes.
And that is where when you take drugs, right, or chemicals or pharmaceutical agents, they go into the system and then they chase it all around.
Yes.
Okie dokie. So radiotherapy and then chemotherapy is available to treat Hodgkin's lymphoma. Then you mentioned another modality.
Yes. It's immune. So there are newer drugs. They are more specific. They are more targeted. We have immune therapy for various diseases. So yes, there are immune therapies that are more targeted to, because sometimes some of the Hodgkin cells can produce some antibodies. So you do antibodies against those antigens that are on the cells. Okay. So it targets the cells specifically. So there are immune therapies we add to the chemotherapy to make it more tight and work better, to give better outcome.
Right. Okay. Now, as soon as I hear those things, and I know my listeners as well, the phone lines are active 0302 216-541. You can call in and ask your questions. I know listeners, when they hear those things, they know there's money involved. Dr. Bashir, I mean, so I've been diagnosed, it's conclusive, and I start my journey of treatment. Okay, she's mentioned two main pillars of treatment: radio therapy and chemotherapy. Is it available, and how accessible financially is this?
Okay, so radiotherapy and chemotherapy, they are both available at Kolebu Teaching
Mhm.
Hospital. At TET 7, we have chemotherapy.
Mhm.
Unfortunately, we do not have radiotherapy as of yet.
Right. Okay.
When it comes to the cost, it's unfortunately these drugs are expensive. How expensive exactly, I'm afraid I can't say.
Mhm. Okay.
That would have to
Okay.
that would be up to the
I'll deal with the man
accountants.
who has the money, right? Maybe Ezekiel can share with us. But okay, so what it means is that if you're diagnosed, depending on where you're diagnosed and the modalities available, you may be moving across facilities if you have combined radio and chemotherapy. So, for example, if I was being seen at 37, I can get the chemo there, but I can't get radiotherapy there. It means I have to go to another location.
Yes, so you can easily be referred
can
to
be referred.
a hematologist at Kolebu Teaching Hospital.
Okay. Let me just swing to you, Dr. Uku. Anything on costs?
I could find
Doctors don't like
current-
talking costs.
Yeah,
Okay.
yeah. We leave it for the
Accountants and then pharmaceutical. Right.
to
Okay.
yeah.
I'm seeing something from Dede, my friend in Maryland. Yes, Dede, yesterday was tough. We bid farewell to a good friend, a mutual friend of ours, Oraina Buidwamoma of the Bank of Ghana yesterday. But she says, can regular blood work detect Hodgkins lymphoma, or what does one have to have the symptoms mentioned and then the further subsequent tests are done to diagnose the disease? She's asking, can it be picked up in regular blood work?
No. Unfortunately, no.
Wow. Okay. So
If it's picked in regular, then it's really advanced. But Dr. Bashir explains the sense. So usually you see it in the lymph nodes.
Mhm.
That's when you would take a step. But
okay. Right. And I've heard some of the those living with the condition and undergoing treatment. The usual challenges with treatment, especially the chemo, loss of hair, and many other things apply to Hodgkin's lymphoma as well. Am I right, Dr. Bashir?
Yes, yes. So these are side effects of the chemotherapy. So most types of chemotherapy would have these side effects. Since chemotherapy in and of itself, it attacks rapidly dividing cells,
Okay.
and hair is one of the cells that is one of the most rapidly dividing cells in the
Okay.
body. So you lose your hair, but it comes back once the chemo is done.
Mm-hmm.
Other side effects include nausea, vomiting.
Right.
Chemotherapy in this case, it can also suppress your bone marrow, so your level of blood can go down.
Okay.
To put it in simple terms, the level of your blood, the amount
Mm.
of your blood can go down.
Mm-hmm.
The platelets can go down. Also the disease fighting, the white blood cells, they can also reduce, and you can be more susceptible to infection. But
Okay.
once the chemotherapy is done and the lymphoma is managed or has gone into remission,
Mhm.
then these symptoms will start to, these white blood cells will start to be produced. Anemia will, you'll recover from these side effects.
Okie dokie. Right. So if you have any questions, phone lines are still active. Ultimate Health on Joy 99.7 FM. We're talking about Hodgkin's lymphoma, a form of cancer that typically and aggressively attacks the lymphatic system of young persons between the ages of 15 to 35, typically, and those above 55, right? And we've got guests in the studio. Dr. Hamza Bashir is with the 37 Military Hospital. He works in internal medicine. Ezekiel Laye is the president of the Michael DeGraft Foundation, Memorial Foundation. They are providing awareness, education, and supporting those undergoing treatment and facing challenges. And then on the Zoom, I have Dr. Nana. Do I keep on making her Nana? Right? Nana Ejewa Ewuku, senior specialist hematologist with the University of Ghana Medical Center out there in Legon. If you have any questions, concerns, phone lines are active and WhatsApp is 055 11 11 997. My question goes to Dr. Hamza. It says, apart from medical treatment, what other support is available to patients?
Okay, so of course, it's psychologically it's a very depressing diagnosis. So we have an excellent therapy and wellness program,
Right.
where we can refer the patients and they can go see clinical psychologists or psychiatrists.
Yep.
Because depression is also a very big side effect of this disease.
Especially with chronic disorders. Yeah.
Yes, so you are taking, you have a cancer, you are taking a chemotherapy, you are losing your hair, you are losing your weight. It can be very depressing and anxiety inducing. So we have an excellent therapy and wellness
Right.
departments where we can refer the patients to.
Right. And not just the patients, the significant others, family as well, need strength to cope with this challenge, right? Not only on the financial level.
Yes, definitely.
Okay, right. I haven't heard anybody mention pain or any, we mentioned sweating and night sweats and all that. Is this person experiencing any other physical challenges that our listeners need to know about?
So the characteristic feature of the enlarged lymph nodes is that they are painless. That's why a lot of the times it gets forgotten about.
Right.
Oh, I have a small lump. It's not paining me.
Okay.
I'll forget about it.
Right.
So only in advanced diseases, when it goes to the chest, you can have chest pain there. If it goes to the bone, you can have bone pain. But these are not the characteristic features that define Hodgkin's
Can I be
lymphoma.
going to work, to school? Can I be planning a family, planning to have children and so on, whilst managing this condition?
Yes, of course. Side effects of chemotherapy, of course, there are nausea, vomiting, but chemotherapy is usually done for about 6 months.
Right.
And during that time, yes, it might be difficult, but you can continue with your...
No
with your
impact on
normal-
fertility?
No.
Okay.
Well,
in some cases,
in a very small percentage, the chemotherapy can lead to infertility, but it's one of the
or challenges with fertility.
yes,
Right.
it's not one of the main side effects of it. A
Okay.
very small percentage.
All right. I'll swing to you, Dr. Oku, in a sec. Let me just read this out. Not a good afternoon. Please, can the doctors give us any information on whether this is preventable? Right? Can you prevent this? Is there anything you should dodge, avoid, tofiakwa? I mean, make sure you're not going near these things, behaviors or foods. Or I mean, Doc Ewuku, you mentioned working with chemicals. You mentioned benzene and stuff like that. Can we talk in terms of prevention when it comes to Hodgkin's lymphoma?
So not necessarily preventing the Hodgkin's lymphoma, but it's more about in your daily work, if you wear your protective gear to reduce your risk of exposure.
Okay.
Because if you were supposed to be using certain types of gloves, to wear boots, to put on mask, a certain prescribed mask or goggles, or during your work, then you have to do that. But you cannot say that I'm doing this to prevent Hodgkin's lymphoma necessarily. Remember that I said that there may be some people who may not be exposed to any of these risk factors, but still develop.
Wow. Okay. Good afternoon, my good friend. I like the health education and I want to be part of the group. Also, education should not be restricted or based in Accra alone. Keta people also need education. This is from Abochi Philip from Keta. So, Ezekiel, after this, you get on a Uber or a bus to Keta. But Philip, I hope you took note of the contact numbers and the social media handles of the Michael DeGraft Memorial Foundation. Ezekiel, can you give that number again?
027 9087
Okay. Right. I see Dede is typing aggressively out there. So, what is the kind of should I say distribution when it comes to specialized care? I know I'm speaking with Dr. Hamza Bashir. He's in internal medicine. I have Dr. Nanajewa Ewuku. She is a specialist in hematology or blood-related diseases and conditions. But how is this spread across our country, Ghana? If somebody's listening to me in Golu or somewhere in Axim, this sounds like it needs specialist attention and investigation and follow-up. Let me start with you, Dr. Wuku. What do people do across the country? I know we've mentioned Kolebu and UGMC and other places, but across the country, do we have the capacity to pick this up and to manage it?
Yes. So across the country, to pick up, yes. Manage, no. Unfortunately, no. So picking up, usually patients will present to their primary health care providers.
Okay.
Sometimes they are sent to the surgeons who will do the biopsy. Once the results come from the pathology lab, they are referred to a hematologist.
Okay.
So sometimes when the primary health care person sees the lymph node, they refer to the hematologist directly.
Okay.
Unfortunately, it's limited to Accra, Great Ashanti, and then Central Region. So in Cape Coast, we have hematologists. In Kumasi, we have hematologists. And in Accra, the various centers, we have hematologists. So it's not that the management...
You handle blood, but you don't go everywhere like blood.
Unfortunately, yes.
Unfortunately, we don't have that capacity.
To go, yes, we are not at full capacity yet.
Okay. Right. Dr. Bashir, so this means that you can be diagnosed, right? If you're lucky, you can have it pinpointed and, diagnosed, identified. But then when it comes to treatment, we need to move to the southern sectors.
Yes, so I think that is unfortunate. The training of hematologists is fairly recent in Ghana. So right now, from what I know, there are only 13 hematologists in the entirety of Ghana. I think 8 of them are at Kolebu, 1 at 37, UGMC, of course, and then Kumasi and Central Region. So you would have to go to one of these hospitals where the hematologists are. But over the coming years...
So the challenge is not just financial access, but even geographical access, if we look at it that way. Right, yes. Where you are when you are diagnosed, and your access and your ability and capacity to move to these specialized centers is a critical determining factor.
Yes, so that would just inflate financial issues.
Yeah. Okay.
But over the next coming years, we expect to see more and more hematologists in Ghana because we're now training them. Okay. It's fairly recent. Right. So over the next few years, let's hope.
Training of hematologists is not recent. It's old. It's just that we don't have a lot of people
choosing their discipline,
being trained as hematologists. It's been happening for a long time, but we are not a lot. Right. Maybe an endangered specialty.
Right. We used to do that in psychiatry and psychology, where we have to have targeted programs targeting undergrads and those in training to make sure that quite a healthy number of them choose the discipline, right? But we definitely need it.
It's improving.
Right. Okay. Somebody's asking me, we're talking about cancer, right? But somebody's asking about mode of transmission. Can you catch this from anybody?
No, you cannot. It's not a transmittable disease. Of course, you can get let's say HIV from someone else,
right,
and that can be a risk factor for this.
That predisposes you as a risk factor.
Yes, you can get Epstein-Barr virus, which is a risk factor for this, but lymphoma in and of itself is not transmittable. We shouldn't shy away from these people thinking that it's dangerous. We might get the disease. We need to this is a very vulnerable time in their life. We need to provide them with the support, the emotional support that they need.
Okay. Great. Good afternoon, Nortey. Very interesting discussion today. My question is, a friend of mine had non-Hodgkins lymphoma and he passed. What is that as compared to Hodgkins? Dr. Ugu, can you quickly hit that? We've already hit 3 o'clock.
Okay, so non-Hodgkins lymphoma. So we have lymphoma. So lymphoma is affecting the lymphatic system.
Right.
Depending on the type of cells you see when you take the biopsy, when you take some of the enlarged or swollen lymph nodes into, depending on the type of cells you see, and when you go further to look at the antigens on the cells, it will group it into non-Hodgkins and Hodgkin's lymphoma.
Okay.
So when you see a specific type of cell called the Hodgkin-Ritenberg cell, then you know that you have Hodgkin's lymphoma.
Right.
Or when you do immunophenotyping and you see some certain antigens, you know it's Hodgkin's.
Right.
If you don't see that, then it's non-Hodgkin's lymphoma.
But nevertheless, it is a lymphoma. It is a cancer.
Yes.
Okay.
Yes.
Nortey, yes, okay, this is Dede again. Kudos to the Michael DeGraff Foundation for the support they provide. I would like to know how vigorous is the fundraising arm of this organization. Have they reached out to firms, organizations, etc.? Some firms have budgets for outreach, etc. Are they linked with other external foundations with the same cause for support? This is from Dede in Maryland. Ezekiel, can you quickly take that?
So please, as it stands now, we are just on our own. We are not linked to any organization or nothing, and we raise funds within ourselves in the foundation.
Okay.
So we've written to other organizations to support us in raising funds, but then we've not heard anything so far.
Right.
So we are still pushing.
Okay. We are hoping we've given you a
Yes,
springboard here, but we'll make time to, should I say, do this again with the Michael DeGraff Foundation. We've scratched the surface. We could have gone a bit more technical and a bit more detailed, but this is what time allows us today. Many thanks, Dr. Ewuku, on the Zoom. We didn't have you in the studio today, but I yanked her in at short notice, to also support this. And many thanks to you, Dr. Bashir. Thanks to you as well. I want to assume and take it that you are a committed member of the foundation and the army under Michael DeGraff.
Yes, I help them
Right.
with
The medical aspects of
With
the
the medical
awareness and
aspect,
education.
yes. Yes,
Okie dokie. Right. Ezekiel, you were going to add something.
well, they are more closely, should I say, in relation with the hematologist of at Tetsa Military Hospital, Commander Ghana Navy Dr. Sarkodie.
Oh, okay.
So and I work under him. So
Okay. So you wanted to give him what? Thumbs up for
a shout out. I
shout
suppose,
out, Doctor. Is it Commander?
Commander Ghana Navy Dr. Sarkodie.
Dr. Sarkodie. We salute you, sir, and thank you for giving us your handsome Dr. Hamza Bashir to come and educate. And Ezekiel, we'll do this again,
Yes,
all right?
please. That's
We'll
fine.
look at the support, and then we'll try and bring in some of the people you are supporting if they are willing to come and speak.
Yes, please.
Because I do believe that we have to really, really, really jumpstart the fundraising. I've seen some of
Yes,
the
please.
figures involved, and there's a lot of work to do,
Okay.
right? Okay. Is there anything you wanted to leave as a message as we wrap up?
In coming August, we'll be having a fundraiser.
Okay.
So we'll be looking out to more people to help us so
Yeah.
we can help other people within our communities who have
Okay.
Hodgkin's lymphoma.
Right. The last fired bullet from Dede in Maryland. She says, why 8 hematologists at Kolebu? It's because it's a pinnacle referral point. There's a lot of pressure there, but I know that we're trying to spread the love. Dr. Uku, why are you all in
I said-
Kolebu? And you,
Kolebu is a training
it's a
center.
training center. Okay.
So far, it's the only accredited center to train hematologists.
Okay. So then,
And also because it's associated with the University of Ghana Medical School too. So then you have
Okay.
a lot of people.
yes, and Dr. Uku recently left us to the UGMC. Yeah. We have to fight about that. But many thanks again, and many thanks to my producer Abeku San Kofi, and many thanks to the Michael DeGraff Memorial Foundation. It must be a major, pivotal thing for his mother, Madame Joan. Some say Joanne, right? Though it's spelled Joan. Some of us Joan Yaboy, the mother of Michael. We salute you. We salute your courage. Some people say you move from tragedy to tribute, and I believe you've done exactly that. And we're hoping we can whip up some support for you. Many thanks again to my listeners, and to Mr. Chene. Chene is in the studio with us. He's a volunteer with the foundational wealth. Stick and stay on Joy 99.7 FM. My name is Nortey by nature, produced by Abeku Sankofi. Don't go anywhere. There's more to come on Joy.